Medicare is changing fast. Aetna has been trimming back its plans, and Sonder Health Plans has now collapsed entirely. There are also big discussions happening regarding the future of Medicare Advantage and Original Medicare. So let's talk about that in today's video. So first, just a quick refresher regarding the basics of Medicare Advantage. Now, if you're already very familiar, please feel free to check out those video chapters below and go ahead and skip ahead. Now, Medicare Advantage is a private alternative to Original Medicare. It must offer at least the same benefits as Original Medicare, but very often it offers additional benefits to entice beneficiaries. Usually these would be things like vision, dental, hearing, and prescription drugs. Original Medicare will pay these private carriers to take on your medical risk. So as a result, you can often access a Medicare Advantage plan with a very low monthly premium or possibly no monthly premium at all. You would just need to continue to pay for Medicare Part B. However, there are significant drawbacks to Medicare Advantage plans as well. Because they are offered by private carriers, you must operate within a network, either an HMO or a PPO. Now, of course, a PPO will give you much more flexibility, but still not as much flexibility as Original Medicare. There's also the issue of pre-authorization and referrals to see a specialist if you do opt for an HMO. Now, we've recently reported that Aetna is exiting the marketplace entirely, but it's also pulling back significantly on its Medicare Advantage plans. It's set to reduce its Medicare Advantage offerings by 90 plans across several dozen states. Now, these are mostly PPO plans, which are generally speaking the more desirable type of Medicare Advantage plans. This will affect thousands of people. Why the change? Well, it all comes down to money. According to Aetna, they are refocusing on more sustainable markets. If your plan is affected, make sure to watch for your annual notice of change before the AEP, which is October 15th to December 7th. Now, anytime there is a huge change like this, there is a ripple effect. Generally speaking, when we see a reduction in plans, that means less competition. And with less competition amongst the insurance carriers, then there's less incentive to offer incentives to their beneficiaries. This could mean a reduction in benefits or possibly higher costs. In addition to the possible rippling effects of Aetna's trimming back its Medicare Advantage plans, there has already been a significant disturbance in Medicare Advantage plans. Sonder Health Plans, which is an insurer in Georgia, has collapsed entirely. On April 11th, 2025, Sonder was put under special state supervision because it didn't have enough money in its reserve to cover obligations. Then on August 13th, the court stepped in and placed Sonder into receivership, meaning the state had taken control because the company was completely insolvent. This was done to protect people who have insurance with them. So if you have a Medicare Advantage plan with Sonder, you are now in a special enrollment period through October 31st. During this time, you could find a new Medicare Advantage plan or possibly switch to Original Medicare with Part D or even a Medigap plan if needed. It's highly encouraged that you switch to a new plan by September 30th to avoid disruption in your coverage. October 1st is the effective date of liquidation and Sonder Health Plans policy termination. That means October 1st will begin the post-termination special enrollment period. That's why it's really better to get yourself situated with a new Medicare Advantage plan prior to the end of September. If you do not pick a new Medicare Advantage plan during the special enrollment period, then you will automatically revert to Original Medicare and Part D. A brief pause here. If you are currently enrolled in a Medicare Advantage Sonder plan, then please feel free to reach out to us in the comments below or at the number on the screen. We are licensed health insurance brokers, we're licensed nationwide, and there's absolutely no charge for our services. Now, we do release these videos on a weekly basis, so please make sure to subscribe to stay up to date. And also, please make sure to like this video, give it a thumbs up so we can get this information out there. All right, let's get back to it. So remember, although you will not lose Medicare coverage, you must act now to ensure that you're enrolled in an appropriate plan. Make sure you have prepared a list of your doctors and prescription drugs so that you can select the plan that's best suited for your needs. These are not the only changes coming to Medicare Advantage. In fact, there is further congressional debate as to the future of Medicare Advantage and Original Medicare in general. Analysts note that Medicare Advantage payments are higher per person than in fee-for-service Medicare, driven in part by coding intensity and other factors. In 2025 alone, KFF estimates a 20% higher payments per Medicare Advantage enrollee, adding tens of billions of dollars in spending. Now, although this is important on a macroeconomic level, How do these things really affect you? Well, more importantly to discuss is the rate of pre-authorization denials with Medicare Advantage plans. A study estimates that somewhere around 17% are actually denied, although many may be repealed at a later date. However, these delays can cause major gaps in healthcare. But there are two big levers in play. The bipartisan Improving Seniors' Timely Access to Care Act would set guardrails on Medicare Advantage prior authorization. This would streamline the process, set timeframes, and require clinical justifications. CMS also finalized the interoperability and prior authorization rule, requiring shorter decision frames and greater transparency. Plans must respond faster and share data more easily with providers and patients. These are undoubtedly good things which would greatly improve beneficiaries' experience with Medicare Advantage plans. There are also debates on reining in overpayments and tightening up coding. But less money in the pocket of the insurers means they're going to want to make up those costs somewhere. So Medicare Advantage plans may still offer extras, but if Congress and CMS squeeze payments, insurers could trim benefits, narrow networks, or exit unprofitable counties, like we've already seen with recent plan reductions. Now, another possible path is to actually strengthen Original Medicare, because remember, Medicare Advantage is simply the private alternative to Original Medicare. These proposals would make Original Medicare more competitive in the benefits that it offers, so that way people don't feel forced into a Medicare Advantage plan. For example, bills have been introduced to add in dental, vision, and hearing coverage. There's also a call to create a true out-of-pocket maximum for Original Medicare. And of course, allow for smoother Medigap access and standard Part D coordination. Plans for this are already underway, and many states are actually relaxing their Medigap enrollment processes. As it stands right now, over half of Medicare beneficiaries are actually enrolled in a Medicare Advantage plan, possibly because of so many of these extra benefits. So even if some of these proposals pass, it would make Original Medicare so much more competitive and possibly lessen the amount of people enrolled in a Medicare Advantage plan as opposed to Original Medicare. So please be prepared for some very big changes on the horizon, and not just if you're currently enrolled with Aetna or with Sonder. If your Medicare Advantage plan is changing or exiting, then your annual notice will spell it out. You can also expect prior authorization reforms if Congress passes the Timely Access bill. And keep an eye on Original Medicare proposals in case Congress does manage to bolster some of those benefits or add an out-of-pocket maximum. Remember, if you are currently enrolled with Sonder, please feel free to reach out to us at the number on the screen or in the comments below. We're licensed health insurance brokers, we're licensed nationwide, and there's absolutely no charge for our services. If you'd like to learn more about some of those Medigap enrollment policies that are changing, I'd recommend this video over here. You can also check out our All About Medicare playlist. And of course, please make sure to like and subscribe. We'll see you next time.